I'm going to get started. My name is Norbert Goldfield, and this is truly an international crowd of people who are joining in from Europe, from the Middle East, from throughout the United States. It's a joy to have you all on the Zoom in these very, very trying times. I have two patients of mine in the hospital with COVID right now. So these are challenging times. What I'd like to do is, I'm going to say a couple words about some administrative procedures, and then just make a very brief introductory comment. I will then introduce Don Berwick, the moderator, who will in turn introduce one of the presenters, Len Rubenstein. He will then hand it back to me. And then Don will moderate the chat box. And we'll have, the three of us will have possibly some concluding comments. Again, welcome to everybody. From an administrative procedure point of view, everyone is on mute except for the three co-hosts. The session is being recorded and will be sent to everyone. The three of us, Don Berwick, Len Rubenstein, and myself, will be looking at questions. Don will be farming them out after Len and I make initial presentations. So that's it from an administrative point of view. For those of you who know me, I very much like to start on time, and I like to end early or for sure on time. So those are my administrative comments. And again, welcome to all as people continue to join. Healing Across the Divides is the organization convening this conversation. And the organization, as you will hear about in a few minutes, its mission is to focus on measurable improvement in health for marginalized Israelis and Palestinians, all of whom are impacted by the Israeli-Palestinian conflict. As part of a series of webinars that we've had all year, this webinar revolves around two books, which are about to be published, somewhat delayed because of COVID, but I'm told they will be published, that generally speaking, focuses on the roles and consequences of actions that health professionals play in our world today. I'd like to now introduce Don Berwick. Don is a pediatrician and president emeritus and senior fellow at the Institute for Healthcare Improvement, an organization that Dr. Berwick co-founded and led as president and CEO for 19 years. He's one of the nation's leading authorities on healthcare quality and improvement. In July 2010, President Obama appointed Don to the position of administrator of the Centers for Medicare and Medicaid Services, or CMS, which he held until December 2011. In 2005, he was appointed Honorary Knight Commander of the British Empire by Her Majesty Queen Elizabeth II, the highest honor awarded by the UK to non-British subjects in recognition of his work with the British National Health Service. I first met Don in the 1980s when I invited him to come to the managed care organization that I worked at that time to speak about quality improvement and improving outcomes, something that I was trying to encourage that managed care organization to do. I've known him since then, and I can say with great pleasure that he's on the board of advisors of my political work that I do in the United States called Ask Nurses and Doctors. Again, Don, it's a pleasure to have you on, and I'd now like to welcome you as moderator.
Well, the pleasure's mine, Norbert and Len. These are two friends and heroes of mine. I've admired the work of both of these people, and the chance to help them discuss their insights and their books is a real privilege. It's a time of enormous polarization in the world. Not only are we dealing with COVID, we're dealing with distance and with othering and a sense of conflict and tribalism that is, it's robbing us of so much good, so much that could be good. It's taking lives, and it's taking health, and it's taking spirit. We see it in the United States, of course, in a terribly dramatic way, with all sorts of roots in political division, structural racism, and so on. But it's also worldwide in the areas of conflict that Len and Norbert know all too well. I think we need to find ways to heal if we possibly can without being naive. There are ethical and moral agendas that have to be defended, but finding ways to reach across these divides is I can't think of a more important enterprise for the human condition. We have problems so big around peace and war and climate change and disease and now pandemic that can't be solved from tribal platforms. They have to be solved from the humanitarian united platform. And these are two leaders that we're going to hear from today that represent the best of thinking and a lot of action in those domains. So this is a great privilege to join them. Back to the logistics. What will happen is after Len has made some comments on his work and Norbert on his, the chat will be open. If you are all bashful and don't make any comments, I have some questions I'll pursue, but this is really your time, the many participants that have just taken your time to join us. So anyway, it's a privilege to be here. The biggest question on the table, of course, has to do with professionals right now, with the healthcare world and what our role is in bridging across these divides. And that's what we'll ask Len and Norbert to comment on from their viewpoint, as well as their more general views of how to create proper action. So I'm going to start by turning the floor over to Len Rubenstein, a person I've admired for decades and had a chance to work with in Physicians for Human Rights. Len is a human rights lawyer. He spent 25 years doing research and investigations in human rights issues and violence, especially against healthcare workers in wartime and conflict zones. He was previously president of Physicians for Human Rights, where I got to serve on the board for a number of wonderful years, and he's a board member of Healing Across the Divides. Today, Len is professor director of the program on human rights, health, and conflict at the Johns Hopkins Bloomberg School of Public Health. Len, thank you for letting me join you here, and you take it away, and happy to hear about your work and your thoughts, and then you'll turn it over to Norbert.
Thank you, Don, and thank you, Norbert, for inviting me to talk about my book. The book is called Perilous Medicine: The Struggle to Protect Healthcare from the Violence of War. It's coming out sometime in the spring. About 20 years ago, in 2002, I traveled to Jerusalem, the West Bank and Gaza, as part of a human rights investigation to understand why Israeli Defense Force soldiers had killed Palestinian emergency medical responders as they sought to evacuate wounded in active fighting in the West Bank. In a mere 2 weeks, 6 of them had been killed. Some of you may recall that this was the time of the Second Intifada, when Israel launched an offensive in the West Bank, the first since 1967, seeking to destroy terrorist infrastructure there. It was a fraught and very scary time. During the course of the Intifada, Palestinian militants committed more than 140 suicide attacks, targeting shopping malls, restaurants, discotheques, buses, and other places central to urban life. Hundreds of Israelis were killed. Many planned attacks were likely foiled. I still remember my fear and tension in Jerusalem. As I walked by bus stops, I found myself quickening my step. The guards armed with automatic weapons stationed in front of restaurants and our hotel seemed more of a reminder of risk than any assurance of safety. And yet there was no excuse for killing the Palestinian medics. Israel, of course, had legitimate concerns about terrorism, including the possibility that bombs and terrorists would use ambulance to carry out attacks. But international law was clear that medical evaluation was essential to preserve lives. Israel's Supreme Court had recognized the legal obligation, and the IDF, the Defense Force, embraced it. To ensure that ambulances were not misused to transport weapons, the law allowed their inspection. The International Committee of the Red Cross acted as liaison between the IDF and the Palestinian Red Crescent Society, the major ambulance service, to coordinate requests for clearance, inspection, and clearance. But what happened was that medics were killed after ambulance had been inspected and cleared. Frontline soldiers were not properly informed of the clearance or engaged in hair-trigger responses when they saw a civilian vehicle, especially during curfews. In other cases, clearance was delayed for many hours, jeopardizing the lives of severely wounded people. In one case, a UN official died because of a delay in approving his evacuation after being shot. The killings became a scandal. Human rights groups wrote detailed reports. The usually reticent International Committee of the Red Cross issued stinging press releases. After the UN official was killed, the Secretary General condemned the acts. Human rights groups brought a lawsuit, and a judicial decision affirmed the IDF's obligations. Many Israeli commanders were also appalled by what was going on. Despite a government public relations campaign blaming Palestinians for the deaths, the IDF recognized the problem was not terrorism or so-called asymmetrical warfare, where an insurgent group is pitted against the conventional army. The problem was gaps in IDF training, procedures, and discipline. Similar problems arose for US forces in Iraq. The response is important to recognize. In 2003 and 2004, the IDF reformed its procedures. As a result, lives of people wounded were saved without jeopardizing those of soldiers. That was the good news. But when the Intifada ended in 2005, another legacy remained. The separation wall and the establishment of more than 100 new checkpoints within the West Bank severely impaired access to medical care, even in the absence of active fighting. The first year of the Intifada, 27 people were reported to have died at checkpoints while trying to get to a hospital. 2002, 39 children were born at checkpoints because of their delays in getting to hospitals. On the West Bank, hospital admissions declined dramatically, and healthcare utilization dropped by 60% because of the checkpoints. Moreover, in the aftermath of the Intifada, checkpoints continued to expand, and an arbitrary new permit system affecting tens of thousands of people were put into place. Palestinians couldn't reach hospitals on the Israeli side of the east wall of the wall in East Jerusalem, where most were located, even though they had tried to get permits. In 2005, the Red Cross negotiated an agreement to facilitate passage, but 14 years later, a monitor said it was still not implemented. For people in Gaza, the permit system has been even more draconian, leaving thousands without access to care. And then, during the 3 wars in Gaza between 2008 and 2014, delays in medical evaluation and shooting at medics returned, despite the reforms of a few years earlier. Hair-trigger rules of engagement in the field led to more deaths of emergency responders and those in need of care. Much of the contention about the wars in Gaza has concentrated on the shelling of 34 hospitals, but I want to keep this focus today on medical evacuation. Almost 100 ambulances were damaged in the 3 conflicts. Sometimes delayed of wounded people was, the evacuation was delayed for a day, 2 days, 3 days, in one case, 4 days. The reforms of 2003 and 2004 were simply forgotten or abandoned, and post-fighting investigations by the IDF were lackadaisical and basically excused the killings. I don't want to single out Israel because it's far from alone in these kinds of violations. I mentioned the US in Iraq. There's a lot worse. The coalition I chair, Safeguarding Health and Conflict, reported more than 1,200 acts of violence in 20 conflict-affected countries last year. And that number is probably a huge understatement, as most are not reported. The Assad regime in Syria has strategically attacked hospitals 600 times in the 9.5-year war. In Yemen, the Saudi-led coalition, using British and American weapons, has indiscriminately bombed hospitals for the past 5 years. The list of violations is very long. That's the subject of my forthcoming book. The violence destroys lives, forces healthcare workers to flee, undermines health programs, and has effect that persists long after the wars because of the loss of health system capacity. Many health workers I've spoken to, even 10 years after a conflict, have shared the continuing trauma they suffered, added to the moral distress they felt at the time at not being able to serve their patients. And we can see some of the long-lasting impacts in Syria and Yemen and Gaza. In Syria, Yemen, polio, cholera, and now COVID has been devastating. The restrictions by Israel on health access for people in Gaza include a refusal to allow ventilators into Gaza until its political demands are met. The result is that there are fewer than 100 ventilators in Gaza. And what makes all this even more tragic is the protection of people needing healthcare is both fundamental to our values and an objective that can be achieved even in war. The value goes back to the first Geneva Convention of 1864, which basically said that in the name of humanity, all people, no matter who they are or what they have done, must be spared the gratuitous and unnecessary suffering occasioned by denial of medical care or attacks on medical care in war. Today, there's not just non-compliance, but impunity. And in some respects, the situation is getting worse as the rise of draconian counterterrorism laws around the world has led to the arrest and prosecution of doctors and other health workers for the so-called crime of offering health care to terrorists. That posture, of course, undermines the very principle of humanity on which the Geneva Conventions are founded. At the same time, many countries that provide arms and military support to their partners or proxies take no responsibility for the use of those weapons and support. I wrote the book to draw attention to the pervasive and devastating consequences of this violence. The book tells many stories about health workers trying to provide care in places as different as Afghanistan and Myanmar, Turkey, Yemen, many other places. I try to explain why these attacks occur, because healthcare is a strategic target, because there are tactical advantages, or because combatants don't comply with obligations to avoid harm. The book's also a cry for action. The UN has often condemned the violence and passed resolutions asking for reforms, but they haven't had much effect. What I think is most needed is solidarity. We've seen the medical and nursing community speak out on behalf of their colleagues suffering shortages of equipment, overwork, depression, and sometimes threats of violence during the COVID pandemic. They and the larger citizenry need to be similarly engaged in speaking out and demanding protection of our colleagues in healthcare around the world. I think it behooves us all to act because healthcare is so fundamental, and recognizing every person's humanity is a value that we have to hang on to. I'll be happy to take questions later, and I'll turn it over to Norbert now.
Thank you, Len, for a very sobering summary of parts of the book. I still remember one of the first times that I met Len was in 2004. And when Len was director of Physicians for Human Rights, USA, and a Palestinian and an Israeli physician came and had a study tour. And it's because in many ways of Len that Healing Across the Divides started in 2004. Essentially, Healing Across the Divides takes another slice of the many different kinds of engagement of health professionals in conflict resolution in what is a field called Peacebuilding Through Health. So what I plan to do in my brief 10 minutes is give a little bit of background on the book, the title of which is Peacebuilding Through Women's Health, with a focus on the Israeli-Palestinian conflict, what motivated me to start Healing Across the Divides. I'll then briefly highlight the achievements of 2 community-based groups that we have funded. And then I will conclude with observations of future directions that an organization such as Healing Across the Divides can take. In terms of the book itself, I'd like to start out with 2 vignettes that essentially lay down some of the psychological aspects of the conflict between Israelis and Palestinians. So in the first vignette, this is in an interview with a pre-Israel formation in 1948 between a machine gunner, Yerachmiel Kahanovich, or YK, by a filmmaker, and we call him the interviewer. And this is in early 1948, before Israel was founded. The interviewer: Operation Broom, what is it? You simply stood in line and just, YK speaking, yes, you march up to a village, you expel it, you gather around, have a bite to eat, and go on to the next village. Interviewer: but how? YK: you mean by shooting? Interviewer: how do you mean? YK: we shot, we threw a grenade here and there. We moved from one village to the other, from one to the next. Interviewer: so you had orders to expel and clean up the villages of Palestinians? YK: and then go home. That's one vignette. The second vignette highlights one terrorist attack on Israeli Jews. It's an interview by a psychoanalyst in her book, From Ultrasound to Army, The Unconscious Trajectories of Masculinity in Israel. Among other incidents, Naftali talks of how in April 1974, he found himself as an Israeli soldier in the coast town of Ma'alot in northern Israel. Quote: when the firing stopped, I ran to the building. Tens of boys and girls, several adults, lay dead or injured on the floor, and several sat leaning against the wall screaming for help. The horrific scene sent me back 30 years to scenes I hadn't found released from since Auschwitz and Buchenwald. I stood there helpless, feeling my legs collapsing beneath me. I hurried outside and sat on a curbstone. And here's a comment from Dr. Shalvi, the author. Unlike the Holocaust, the Israeli soldier is an answer to the helplessness of the school children and of Naftali, who once again faces the Holocaust. When Naftali read my interpretation of his emotions, he admitted wholeheartedly that I had hit the nail on the head. So those are 2 vignettes that underlie many aspects of the Israeli-Palestinian conflict. From an American perspective, we should know that Israel and Egypt are the largest recipients of American foreign aid. Americans are involved in the Israeli-Palestinian conflict. As a health professional, since I'm not one of those people who could make an impact on the Israeli-Palestinian conflict from the top down, I, as a health professional, with many, many other hundreds of health professionals, work from the bottom up. As discussed in the book, there are many different aspects of Peacebuilding Through Health, which was developed by the World Health Organization and the Pan American Health Organization in the late 80s, two of the aspects of this peace building through health work are strengthening of communities and communication of knowledge. Through that, we have funded almost 50 community-based initiatives in the 16 years of our existence. Again, the mission of our organization is the measurable improvement in health of marginalized Israelis and Palestinians through community-based interventions. We do that through already existing community groups. We try to strengthen them, both the groups themselves and their leadership. Let me give you two examples of the almost 50 initiatives that we have funded. As many of you know, diabetes is an epidemic throughout the world. We have funded 6 interventions pertaining to diabetes, different groups in Israel, different groups in the West Bank, and now also in Gaza. It's important to distinguish between what we would call evidence-based and based on evidence. Evidence-based and based on evidence. The first few initiatives that we funded were based on evidence, but they were not evidence-based in the sense that the intervention was not systematized. We were then lucky to then hear about and know about, and I became a master trainer in a program developed at Stanford by Professor Kate Lorig, who is on the Zoom today, called Chronic Disease Self-Management, which, as you'll imagine in a minute, is a form of empowerment. We have implemented the CDSMP, or Chronic Disease Self-Management, in 3 different groups, and have had a measurable improvement on health for thousands, not tens of hundreds, but thousands of diabetics and their families. A second example is an intervention that we funded pertaining to childhood domestic accidents. And injury is the leading cause of death in children and young adults. Approximately 12,000 children and young adults die from unintentional injuries in the United States each year. We put out a call for proposals, and there was a response trying to do an intervention with Palestinian women living in Israel. And the overall, after 3 years, household safety scores showed that a dramatic improvement. Just as importantly, the volunteering grandmothers, because this was done through grandmothers of this initiative, learned many of the practical aspects of community activism. Healing Across the Divides not only worked with the community-based organization to develop the best possible evidence-based intervention on childhood accidents, but we also worked with the volunteering grandmothers on on community activism. In recognitions of the accomplishments of this initiative, the community-based organization won an award from the Israeli government and an award from a childhood injury prevention organization that's worldwide. And just as importantly, we have now, they have received a matching grant from the Israeli government to continue the work with ultra-Orthodox Jewish families. So in my last comments, to be effective in the Israeli-Palestinian conflict, it's important to make a careful assessment of its current political state and its impact on organizations such as Healing Across the Divides. I believe, as the founder and executive director, together with a board of directors that is of Arab Americans, Jewish Americans, and other Americans interested in the Middle East, that the focus of Healing Across the Divides should be, in the long term, to increase resilience and organizational strength of the leadership and overall organization of the community groups that we fund, while in the short term, to measurably improve the health of as many marginalized Israelis and Palestinians as possible. We do that with the support of people like yourself and with amazing on-the-ground representatives in both Israel and in the West Bank, in the Palestinian territories. We have a representative that provides both the technical and managerial consulting with a backup from people on the scientific advisory board together with people from the board of directors. I'd like to now hand it back to Don, and he will start to moderate the conversation. And we welcome all and any questions regarding the work that we've done for many years. Thank you to all, and I'll pass it on to Don.
Thank you, Norbert and Len, not just for your comments and your books, but for all this amazing work that you've been involved in. It's inspiring to listen to you. So we have a bunch of questions in the chat that I'll triage. We don't have a lot of time, so I'll just ask you to keep your answers reasonably short. There's one practical one from Amy Hagopian just now about the name of the publishers of your books and how you can use the books in helping to organize a response to the problem. So can you just quickly give us that information? I know it was in the announcement, but you would repeat it. And also, you guys, you might want to type it into the chat. So Norbert, your publisher, and how to use the book.
We'll just type it in the chat in terms of the publisher, which is Routledge. And I'll also say a statement of the book at my concluding comment. Important from a peacebuilding through health perspective and the types of impact that health professionals can do. And frankly, I would assume, though this is not my area of expertise, that for sure we know that Len is a lawyer. Lawyers are very much engaged. So a lot of what we're doing is really relevant for any kind of health professional individual that's trying to be engaged. Len?
was putting in the chat. My book is by Columbia University Press. It's supposed to come out around late June, which is later than I'd hoped, but it will be available then. And we can certainly get information about it when it comes out. And what I hope the book will do is educate the public and put more pressure on policymakers to do something about this problem. And there are really good solutions. I didn't get a chance to talk about many of them, except as you heard, in Israel, there was a solution for a time. So that's my two objectives: to try to influence policy, but also to raise awareness to put pressure on the policymakers.
You too know if your books can be ordered in advance now, or do we have to wait for them to appear?
Well, I think you've sort of, in a way, jumped the gun. So I'm going to say it right now, which is to say that this is, and I'll probably repeat it again at the end, that this is the time where organizations are trying to raise funds. And as part of the appeal, all you got to do is send me your interest in buying any of the books. We're also using the books to try to raise funds. And if you can make a commitment of $300, you'll get my book. Altogether with $500, you'll get both books. But if that's not possible, just send me your interest and I will take care of it.
Thanks, Norbert. Let's repeat that at the end of the webinar. So back to some questions that have been in the chat, and I've got a few of my own. Noah Nesson is asking about disparities in health outcomes for Palestinian Israelis. Have they been measured and documented, and are there biases built into the clinical algorithms and ways they're being cared for? While I've got your attention, that there are a couple of questions also about what plans are for COVID vaccines, if there any exist yet for Palestinian Israelis and for Palestinians in the Palestinian territory. So Len, do you want to start your answer to that? And then Norbert, you probably have some comments as well.
I can't speak to the first part. The situation in Gaza is really quite dire with COVID. There was a long delay in serious outbreak. It was only in the last couple of months that it really got serious. And now there are something like 15,000 cases. There are only 300 beds in the entire place for 2 million people. And they don't have all the reagents and everything required for testing. So basically, the response has been on almost total lockdown, which which creates its own form of suffering. So it's really quite dire. I don't know the vaccine question. As everyone knows, I'm sure there's huge debate about how poor countries are going to get access to vaccines in appropriate numbers.
Real briefly, disparities have been measured among Palestinians living in Israel, and just take the example of diabetes. There's a significant gradient that does exist. It's also with respect to domestic violence, and we've done that work also. Mammography, we haven't done the research, but we have funded initiatives on domestic violence among Palestinians living in Israel. With respect to the vaccine, I can give some information. There's no question that Israel in the past has one of the many positive things in terms of the communicable diseases. It's in Israel's self-interest to immunize as best as possible, not just within Israel, but also within the Palestinian territories, because there's a fair number of Palestinian laborers who still come from the West Bank to work in Israel. So I would imagine that after Israelis are vaccinated, vaccines will be made available in fairly short order, quote unquote, for Palestinians. But in the meantime, it is extremely dire in Gaza. And for until 2 months ago, it was pretty good. But we're like facing a situation like we're facing in my clinical practice, where people are saying, patients of mine are saying, but I was totally in lockdown, and one of them now is in the hospital, et cetera.
A question is coming from Ellen Siegel that sort of raises a broader issue. She is saying she finds it ridiculous to compare these transgressions by Syria or Yemen or Saudi Arabia, I assume, to Israel. Israel's supposed to be democracy. And I guess Ellen's question is really, is Israel being allegedly a democracy, do you guys feel that it has any special burden with respect to these violations of the Geneva Convention and other humanitarian rules, or not? How do you think about that?
I think there's two questions. One is, and many people raise this issue as we do, you can't compare the strategic bombing of hospitals in Syria to Israeli conduct in Gaza and the West Bank. That the scale and the kind of malevolent intent is so much greater in Syria than Israel. So we obviously have to recognize that. At the same time, these obligations are real, and it's not just because it's a democracy, but because there is a matter of one of the strongest global values, consensus, in terms of protection of people in conflict, are the Geneva Conventions, and they apply to everybody, and they apply to armed groups as well. And I didn't talk about Hamas, and only because of time, but everybody is bound by them. And I think that countries that do purport to recognize these values, like Israel, whose Supreme Court and IDF has embraced them, have an obligation to abide by them and to hold people who violate them accountable. It's not that they have a higher obligation, but we ought to expect them to abide by it. And the fact that the violations are not as grotesque as bombing hospitals 600 times does not mean that they shouldn't be held accountable for obedience to the law.
I'll leave it up to Len. I think Len answered the question exactly how I would have.
Shauna Novak is noting something for information that there's an Israeli-Palestinian binational COVID-19 task force, which I did not know was set up to address issues related to the ICU training and vaccination supply chain and logistics. Are you aware of that? And you want to comment on that effort?
So as I indicated, there's no question that that is the type of work that Israelis and the Israeli government understandably sees it in its own interest to move along, not just with COVID, but with all communicable diseases. So there's been a very strong effort to vaccinate all people living in that region for many years. And I would expect that the vaccine to be available fairly shortly after Israelis get vaccinated.
I have a question while we're waiting for others in the chat. Both of you quote very detailed statistics. Len, you have counts of exactly how many women gave birth at the checkpoint and stuff. How can in this conflict arena we be so, do we get those data? I'm impressed by the apparent transparency. How does that happen?
One of the characteristics of Israel, perhaps, not perhaps, but because it is democracy, is that human rights groups are very active there, and they document these violations. And there's actually a group called Maxom, which is an Israeli women's group. It translates as Checkpoint Watch, and they have collected data and tried to pressure the IDF for compliance. So, and the WHO also collects data. So it's probably the place in the world where the best data exists. Now, the flip side is that Israelis sometimes complain that, we're not, our numbers look so high because nobody else's numbers are being counted so well. But the data in Israel is quite good.
I'll comment on that also. The situation is as Len described it, but I want to highlight that it is getting more challenging for these Israeli groups to operate, whether it's Gisha in Gaza, whether it's PHR Israel in the in Israel, or Maxom or other groups. We Healing Across Divides are a founding member of an organization called Alliance for Middle East Peace. And I will send out in sending out the recording that I'll send out later, I'll also send out information about an event that they're hosting. Bottom line being, as is occurring, unfortunately and tragically in the United States, where people's names and home addresses are being listed, this is occurring for example, women who belong to Maxom. And there is absolutely a fear for many of these organizations that, for example, belong to the Alliance of Middle East Peace, both in Israel and in the West Bank, not just in Israel, but both places where they are increasingly being harassed and attacked for their participation in collecting the kind of data that Len's speaking about, that you spoke about, Don, and trying to do something about it.
One of the commentators in the chat is questioning my use of calling Israel a democracy, because he says a democracy ought not to be controlling the lives, health, and dreams and futures of millions of people for decades. So we're approaching the end of our time, close enough that maybe I want to just ask you one more question, the two of you, and then you can ask you to make some concluding comments. We're getting a new American administration in place. Joe Biden's coming in, of course. What would you advise a Biden administration to do to work on the topics that are so compelling to you? And I guess I'll say, so far, have you seen any picks in his foreign policy choices so far that bode one way or the other in terms of healing across the divide and protecting humanitarian conventions?
You want to go first, Norbert?
Norbert, why don't you start?
Yeah. So I would divide it into a few parts. Number one, at its kind of simplest level, which is, money. I would expect that the Palestinians in the West Bank and Palestinian groups in Gaza to be, particularly in the West Bank, maybe in Gaza, to be eligible for some funds that were from USAID that were denied in the past. Certainly, I think that the Palestinian Authority is hoping for a restart of funds also. So that's at the level of funds. And I think that'll happen. At the political level, some of the appointees, some of you I'm sure or may have heard, that some of the appointees are more what I would call middle of the road. There's one woman who was appointed who's actually a Palestinian American and who was immediately rather strongly attacked as being anti-Israel, anti-this and anti-that. So I guess what I would say is, despite the fact of what I would consider traditional type of largely Obama era appointees, the reality is I don't see much happening at a macro level through the Biden administration. That said, I think that Healing Across Divides, we'll try to work as actively as we can with different groups, both in Israel and the West Bank, and hopefully we'll be allowed to engage in Gaza, where the situation literally is desperate. Len?
In one sense, moving away from the Trump administration is fantastic. As you probably remember, Trump was actually in favor of committing war crimes. He pardoned war criminals. He urged the US military to commit war crimes. During the battle in Raqqa against ISIS, the US bombed hospitals and others and leveled the city because the rules of engagement were so relaxed. So in that sense, it's going to be a dramatic improvement to have the values affirmed instead of rejected. At another level, it'll continue to be a struggle, but I think that there are opportunities to increase the commitments to changing military practice, to have better accountability. The question of whether there'll be more pressure on things like arms sales is going to be much tougher. The Obama administration is the one that supplied all the weapons to the Saudis and continued them when they knew they were being used to bomb hospitals and civilian infrastructure. But I think there's a lot of hope that with sufficient pressure, the Biden administration will be responsive, because at the very least, it will embrace basic values of protection.
Well, thank you. Thank you both. I wish we had more time, but we're closing in on the hour. And I'd just like to give you a chance to make some closing comments, each of you, and Len first, and then Norbert, you, and of course, make your pitch. Of course, we're all anxious to hear it. And then I'll make a couple of other comments and we'll move on. Thank you so much. So Len, do you have any closing comments as you think about where we are and where we need to go?
Well, I just urge everyone to try to get involved in these issues. And for those of you who are health professionals, to really raise this. I mentioned at the end of my talk, solidarity. I think that really has been missing. And I think those of you who are in any kind of health field should seek engagement by the professional groups and make sure that this issue gets more visibility and can really be solved.
Len, if someone listening wants to be engaged, as you say, what are 2 or 3 specific steps people could take to become more engaged with this issue, both in the Israeli-Palestinian side, but also the greater issue of humanitarian values being protected?
For those of you in the Middle East, Physicians for Human Rights Israel is very involved in this issue, and I work closely with them. You can also get involved with the coalition I mentioned, Safeguarding Health in Conflict. You can just send a note at safeguardinghealth.org. Just go on the website and send a note there. Or you can contact me. Norbert can share my my email contact. I'll be happy to get into a conversation, have a conversation with you about how you can be involved given your circumstances.
Len, can you say just a couple more words about Safeguarding Health and Conflict, the organization, just so people can get to know it just a bit better?
Thank you. The coalition is 40 organizations. They're humanitarian, health, human rights, and human rights organizations, a lot of professional organizations, and civil society groups in different parts of the world. And what we do is we do a report every single year on violence against healthcare and war. I mentioned the report last year, and that's also on the website. And we do policy and advocacy work at the global and domestic level. We work with WHO, we lobby at the Security Council. We just got a provision in the defense bill that just passed yesterday that requires the Pentagon to review its procedures. So we try to make an impact, and anyone who's interested, just let me know and I'll get you involved.
And it's safeguardinghealth.org. That's the website.
Yes.
Thank you. Norbert, your closing comments, and thank you again for everything you're doing.
So most importantly, thanks to everybody, and especially to Len and Don. As I say, and those of you who know me have heard me say this before, that I'm the lucky one to know the two of you, really. As a broad statement, the reality is you'd think, and I write about this in the book, that physicians and health professionals, with all the attacks that you've heard about this morning and early this afternoon, they would just give up. But you know what? Health professionals are never going to give up. We're going to continue to try our best to improve health of marginalized people everywhere. We will do it as best as we can, understanding that things are challenging, understanding that the incoming administration will be far from perfect. But let me be clear, as you've heard from Len and you've heard from Don, health professionals, it's part of who we are, never to give up. And that ties in a way to healing across the divides, which is to say, yes, we understand that there's a tension, and I highlighted some of the primordial, reasons that are to that tension, and it's on both sides, and we understand that. But we as health professionals believe that we can make a difference through an organization like Healing Across the Divides. How can you be engaged? For sure. There's expertise that you might have that you can work with us on when we do calls for proposals. There's certainly we have an annual study tour that hopefully you can come on. There are several people who I haven't seen in quite some time, probably since the last study tour that I see. We have an annual study tour. This year it didn't happen. We hope that we'll have maybe not just one, maybe even 2 study tours next year, but come on a study tour. Certainly if you have other skills and you want to be engaged with the organization, as already highlighted, the board of directors and the scientific advisory board. Lastly, I do want to highlight the fact is that on the one hand, we do operate on a very much on a shoestring budget. But as Don knows particularly, and some of you know, that community-based interventions cost very little. That's what's of course the most frustrating about the fact that we don't support them in general in the United States and many other countries. But the reality is we can do great work with relatively small amounts of money, but in fact, we still do need funds. And between now and the end of the year, there is a $30,000 matching grant that up to $30,000 that we will match it dollar for dollar. And in addition, I just want to highlight that we will forward on to you. My book is supposed to come out delayed in April. It's supposed to come out now, but we don't know at this point. And hopefully Len will book will come out shortly thereafter. Just email me that you would like it. And if you are able to, $300 for mine and $500 for both of them. But that doesn't work for you, we'll figure it out. Just tell me when you want it. In summary, what I want to say is, like I said, health professionals will never give up, and you can hear it from the words of people like Don and people who work with health professionals like Len, that there are good things that are happening, and they will continue. And now I'd like to just, for the last word, leave it to Don, and thanks to both of you and to everybody for being on the Zoom today.
Yeah, I thank you so much, Norbert. It's very moving, and we need to get more help to this. I'm not going to take the last word. I want to give you a chance first. You're a great storyteller. But in 1 minute, tell us a story, one event, one encounter, one person in Healing Across the Divide that moves your heart, that you think about as containing the meaning of that work.
Well, I mean, there's so many, but I'll just say one. And I mean, as soon as you said it, of course, my mind went blank, which is the usual response. But of course, then there's a flood of memories that come in. And I would just like to highlight a woman, Najwa, who a Palestinian woman who is leader, who took the training, the chronic disease self-management training. And then she worked on her, she did not have a job or anything like that. And then worked with a community-based group to apply for a grant. And she is the leader of this group. And so the chronic disease self-management program impacted her personally. It impacted her family, of which of course is most important to her. But then she independently worked with a community-based group, applied for a grant, and is one of the leaders. But there are so many other stories. I mean, we could go on, but you know what? Come on a study tour. It's great to see everybody. I'll leave it to Don if you want to say a last word and go from there.
Just thank you all. Thanks for the work, Len, that you've done for so many years, you, Norbert, for so many years, and for all of you for the support. It's been a privilege to get to host this conversation. And my only complaint is these books aren't going to appear anywhere soon enough. I really wish they were available right now. So I'll be first in line when they actually get out and published. Thank you both, and thank you all. Have a great day.
Thank you, Norbert and Don.
Bye-bye.